Today I'm going to talk to you about infertility and what that entails for a workup and when you need to see a specialist. Infertility is the inability to conceive a pregnancy within a specified time period. Women who are able to get pregnant will conceive within the first 2 years of trying 85% of the time. So a year may not be long enough. One thing I've found is people that obsess too much about conceiving and have the app on their phone so they know when they ovulate and put so much pressure on themselves and their partners, they actually have a harder time to conceive because they're stressed. Stress produces cortisol. Cortisol will kill your little eggs. So stop stressing, relax, enjoy the process. If you're older, you may not want to wait 2 years to see if you can conceive. What does older mean? In your 30s, let's say. 35 seems to be a magic age. Well, there's nothing magical that happens at 35. Your fertility steadily decreases with age. Women in their 30s, we're not going to waste too much of their time at our office before referring them to the fertility doctors. So, regarding a workup for fertility, the very first thing that needs to be done is a semen analysis, which is a detailed and microscopic analysis of the semen coming from the male. And there's a specific way it has to be obtained, which I'm not going into here. But let's say the partner has a perfectly normal semen analysis. Then the next step is to start working the female up. 40% of infertility is caused by the male or male and female together. So it's important to do that before doing expensive and potentially invasive things on the female. So the first step, probably even before a semen analysis, is to ask a lot of personal questions and review things such as age. Have you ever conceived before, or has your partner ever had children? What is his health and yours? Do you have risk factors? Are you unhealthy or have a disease that might interfere with fertility? Do either of you smoke? Smoking will certainly make it more difficult to conceive. For females, it's important to know that you're having regular monthly menses. If you're not having a regular menstrual period, you're probably not ovulating. And then that requires a workup to make sure that one of those many hormones that I talk about in another session about irregular menses, to make sure all those hormones are normal. And make sure you're not pre-diabetic, which is another cause of not ovulating. So there's that whole workup. If you're having regular periods, ergo ovulating, then do you have pain throughout the course of the month? That may indicate you have endometriosis. The only way to diagnose that is through laparoscopy, belly button surgery, the type that's done by taking your gallbladder out. In this day and age, it's done in the operating room. So you want to have that investigated. And at the same time, you have a laparoscopy. If you make it to that step, you can have dye injected through the cervix into the uterus to see if it comes out through the fallopian tubes, to see if your fallopian tubes are open. Another test for your fallopian tubes, another way of doing that, if you're not somebody who needs a laparoscopy, is called a hysterosalpingogram. Fancy name, HSG. It's actually done by the radiologist in the hospital, in the radiology suite. They have fluoroscopy or x-rays that move real time. And they put something on your cervix, inject the dye, and then turn the fluoroscope on and see if they see it coming out your fallopian tubes. So tubal patency, or open tubes, is one of the steps. And then depending on what's going on will determine how it's treated. And you know, a lot of people come into the office and say, I need Clomid. Well, Clomid is one of the easiest first steps, but someone who's ovulating really probably doesn't need Clomid. Clomid has its own set of potential side effects. It can make your cervical mucus unfriendly. So Clomid is kind of reserved for people who don't ovulate regularly, but have in the past and do ovulate coming off a birth control pill. For instance, if you give them a pill, birth control pill, for 2 months and they stop it, and they have a period when they stop it, but then they have one a month later, that's a good sign they'll respond to Clomid. Clomid is generic now, so cost isn't a huge factor, but again, it can cause other problems that do make it difficult to conceive. There are other medicines that can be given in conjunction with it to help stimulate ovulation. I personally don't do those things in my office, but I know that one of my other 2 doctors will do that on occasion in an appropriate patient, and those doctors are Dr. Ashcraft and Dr. Knockout. For people who are older, as I said, in their 30s, or don't ovulate at all, and their hormones are normal, and other people who just don't want to waste any time, we send them to the infertility doctors in Chattanooga. And I think that's the kindest thing to do. Now, I don't have a lot of information about the infertility doctors in terms of what they're doing currently. There was a time when the infertility doctors would do a free consultation. I'm not sure if they're still doing that, but it is good to ask when you call. Make sure they take your insurance. I know there are a lot of things that they can do and bill your insurance for. Most insurances don't pay for procedures or blood work that's labeled or sent with the diagnosis of infertility, but there are ways of avoiding that. Pain, irregular periods. Anyway, speak to them, get as much information as you can, find out what the process is, make sure they take your insurance, and please do come to us if you need that referral or a workup. Thank you.